Good afternoon, everyone. It is a joy and a pleasure to be with all of you and to again see so many people in person. I think, as Pastor Bethea might say, this is the day the Lord has made. Let us rejoice and be glad in it. And Dr. Branch, that's right. We got Reverend Dr. Branch as well, too. But this is a day in which we are truly excited to be here as we really announce an important next step in Baltimore County's history, in this site's history, and in partnership with our friends in the faith community. I am thrilled to be joined today by Dr. Gregory Branch, our health officer, our administrative officer, Stacy Rogers, Dr. Karen Bethea, senior pastor here at Set the Captives Free. Dr. Bethea, thank you for your ongoing commitment to the community and the many ways in which you serve. Because of your partnership, we are here to announce a really transformative partnership, opening a new state-of-the-art health center right here in Woodlawn, and we could not have done it without you and your team's partnership. I do look forward to worshiping alongside you and the congregation again in the near future. Also glad to be joined by Margaret Stokes, representing Councilman Tom Quirk. We have Council Chairman Julian Jones, who has been such a key partner throughout this pandemic and on this project, and also want to recognize Delegate Pat Young, who is here representing the state team as well. We believe that everyone in Baltimore County and beyond deserves access to quality health care options, and community centers do help serve as a critical safety net for so many, often providing that essential care to those who need it the most. And that is what local government is here for. We're here to close the gaps and do whatever we have to support the health and well-being of our neighbors and residents. Unfortunately, the COVID-19 pandemic has underscored the need to do even more to support community health and address chronic health conditions that impact our neighbors and loved ones. Baltimore County currently operates 8 health centers across our county, offering everything from counseling to immunizations, to family planning services, to STI screening and treatment, behavioral health support, and so much more. And I want to thank all of our many health providers who have joined us today. Dr. Branch, you have an amazing team, Della Leister, our deputy, and all of our health providers here and across Baltimore County. Our Woodlawn Center is, among all of those sites, the busiest, serving over 3,600 residents per year. That accounts for about 25% of all patients served by Baltimore County health centers. Despite that, Woodlawn Health Center has also been our smallest, operating for years in a small space below the Woodlawn Library. That limited space meant that our patients would have to face long waits for these critical services, or even have to go to other places to access care. But thanks to this new first-of-its-kind partnership with Set the Captives Free, we are excited to open up this new health center here at the OWE Center at Security Square Mall. By partnering with a trusted pillar of our community, Baltimore County will now become a one-stop shop that removes critical barriers to care, that improves the patient experience, and that ensures we have equitable access to healthcare here in this portion of Baltimore County for years to come. At 8,800 square feet, this center is more than doubling the size of our previous center, providing a modern healthcare center for all of our residents who will be coming here. And by locating this site here, we'll also provide our patients with improved access to public transportation, expanding on-site parking, and offering more direct services to community members. In addition, Baltimore County plans to also relocate our Woodlawn WIC here, in addition to the new Woodlawn Health site, to provide improved access to both services in one convenient site. So this move ensures that our WIC services will be provided at all of our county health centers now as well. I want to thank the Baltimore County Department of Health and Human Services and our property management team for working with our partners to Set the Captives Free for their innovative approach in this project. And again, Pastor Bethea, thank you for your partnership. With that, I will turn things over to the County Administrative Officer, and we'll go through our speakers, and we're happy to take questions at the end. Madam Administrative Officer.
Thank you, Mr. County Executive. Good afternoon, everyone. It is indeed a wonderful, wonderful day here in Woodlawn. You know, the word says that where there is no vision, the people will perish. Well, we are so thankful that we have a county executive who understands that, you know, literally and scripturally. He does. And we are very, very pleased to have had the opportunity to work with Pastors Bethia and her team, and to be able to bring this vision to reality after many, many years of trying to make this happen. It has been my pleasure to work with the county team to make sure that the resources that were needed and the coordination to ensure that we came in on time and within budget, despite a pandemic. So I want to thank Dr. Bethia and the team, and I'd like to also thank Dr. Branch for continuously guiding us in terms of why this was so important. This, as the county executive indicated, is the first time that Baltimore County will have all of its health centers and WIC services co-located in our county, and that's worth a round of applause. In closing, I would just like to say to our property management colleagues who led the contractual work and the actual construction with our contractor, so many thanks to you, Deb Schindel. She's back there in the back. But it takes a team. We operate in the county on a wagon wheel. It takes a team of people to make things happen. But it would not happen without partners like Dr. Bethia and the team here at Sector Capitals 3, which we are truly, truly grateful. Now it's my pleasure to turn it over to Dr. B, our leader. Dr. Branch is just an extraordinary leader in his own right, but we are very, very fortunate to have him as our health officer and director of the Department of Social Services here in Baltimore County. Dr. Branch?
Thank you, thank you, thank you. Oh, happy day! This is a happy day. Oh, yes, it is. Good afternoon to everybody. And thank you for joining us at this beautiful location. Getting here was years in the making. When I first came to Baltimore County government, that was in 2006. One of the first things we recognized was our need for a new Woodlawn Health Center. Even back then, the center was outgrown for space. Space constraints meant that our WIC center and our health center was housed in separate locations. That inconvenience resulted in missed opportunities to effectively provide the needed supports to our patients. So what does that look like? Here's an example. A parent would bring their child into the health center on Woodlawn Drive for an immunization. But that child would also benefit from WIC services. So our staff would have to send the parent and the child, or more often was the case, the parent with 2 or 3 children, they had to go to the WIC center located on Lord Baltimore Drive. That meant another bus ride to another location. That required an additional bus fare and additional time. Add in the potential for extreme cold weather. On a day like today, extreme heat, and maybe even raining weather. And they had to do that while waiting for the bus. And you gotta throw in the fact that they may have had 2 or 3 children in tow. They're tired and they hadn't had lunch yet. Odds are that the parent would weigh all of these factors and might opt to bypass the second trip to the WIC center or the second trip from the WIC center to the health department. So today, that same family is able to go right down the hall to receive whatever services that they may need. It's taken quite some time to get here, but wow, what a difference. On behalf of that family that can now benefit from our true one-stop shop, I would like to thank our county executive, Mr. C.E., our Chief Administrative Officer, members of the County Council, and of course, Dr. Karen Bethia and Sector Capitals 3. Thank you for your committing to bringing this wonderful public-private partnership to fruition. And of course, my sincere thanks to the Baltimore County Department of Health team for all their hard work and ongoing commitment to this project. I would like to take a moment to introduce that team. Deputy Della, can you just raise your hand? There you go, Deputy Della. My Deputy of Finance and Administration, Lawrence Richardson. Lawrence, are you there? You go, Lawrence, thank you. My Director of Clinical Services, Renee Youngfellow. Renee, just give a little wave. And our WIC Center Director, Dr. Deborah D'Souza. Is Dr. Deborah here? Okay, then, but we just want to thank her in her absence. When we were here several months ago to announce our plan to move this facility, I said that we historically lacked space and convenience at the former Woodlawn location. While that was true, it was also true that we were never short on committed staff that are dedicated to the individuals and families that we serve. And that continues to be true, and I want to thank them and all of you for working to make Baltimore County community a healthier place for our residents to live, work, and play. God bless each and every one of you, and now I will call to the podium Dr. Bethia.
Good afternoon. Can we give a hand clap of thanks to this amazing team? You know, I taught in Baltimore County Public Schools for 18 years, and when the Lord called me to ministry, the first thing I said was, do women pastor churches? Well, they do. And I remember sitting in our facility over at 7111 Windsor Boulevard, and one day I went to lunch and the Lord said, stop past Security Mall. Now that may bore some of you because some of you may say, does the Lord speak to people? He really does. We're not always listening. But I walked in and he said, this will be your next home. And I thought, Lord, I'm retirement age. I'm about to wrap this up and give it to a younger person. And at that time, I couldn't see ministry out of the box. But the second time I came here, the first time I came, I said, I can't do anything with this. The second time I came, which was 6 months later, he said, look around. There are needs in this community that can be filled if you will come here and build a community center. And what I've learned about the Lord that I really love, he always pays for what he orders. And so when I went back to my team, I said to the board, I said, we're moving. They said, where? I said, Soul Plaza. And they said, okay, Pastor, we've walked with you through some tight places before. This was a 5-year journey that began with Kevin Kamenetz. And I thank God that after Kevin, God rest his soul, I love him and I miss him. When Johnny O came on board, he immediately embraced the vision. And I said, you know, a lot of people are thinking, why would a church buy that? Well, we're not a church only. We are a community center that happens to have a church on the second floor. And so we are excited about today because it has been 7 years in the making. What you see today is just the beginning of many community services that will take place in this beautiful building. There will be a 24-hour daycare because everyone does not work 9 to 5. Amen. There will also be other community organizations that are coming to provide. We have a youth center which opens this September. We have a group of engineers who are going to teach children robotics, and they're going to compete on a national level. The superintendent is already working with me to have those kids bused here after school, and their parents can pick them up later. So when I tell you, we also have a partnership with Coppin. On the second floor is a education wing, which Coppin will offer courses here for those that don't want to park down on North Avenue at night. So when I tell you that we are more than a church happens to be in a community center. So I want to thank all of you in your respective places. We could not have done it alone, but because of your partnership and for hearing the vision, people are still asking me, why is a church at the mall? I said, come and see a community center with a church on the second floor. right? And as I close, I just believe in treating the whole spirit, soul, and body of a person. And so you're going to see all of that happen here. There's much more to come. Thank you all for today. God bless you.
Good afternoon, everyone. Hi, I'm Julian Jones, the chairman of the County Council, and I'm very, very, very excited and happy to be here today for this wonderful occasion. I remember when we were talking about the different weather, Dr. Branch, and I know we experienced probably both ends of the spectrum. We came here for the groundbreaking, and it was so cold you couldn't stand here. Papers were flying, the wind was blowing, the podium was falling. It was quite an ordeal. And now today we're here at the other end of the spectrum. But let me just say one thing before I really get into the heart of my conversation or my speech. You know, I worked in the fire department for 32 years. I retired as a division chief. And I was in charge of the training academy for many years and taught a lot of courses. And I know what leadership looks like. I know what leadership is. And what I'm here to tell you is behind me is truly true leaders in each one of their respective fields. In any way you look at it, they are true leaders. We are coming out of this pandemic. And as we try to get out of this pandemic phase, I'm here to tell you the county executive, the chief administrative officer, Dr. Branch, Dr. Bethea, really truly did some remarkable things in terms of keeping our community safe. I saw Baltimore County government transform, and all of a sudden, we put the health department in the front, and everybody else took a second seat. And we watched the health department take on steps that was truly designed to keep us safe. I saw us transform the police and the fire department into social service agencies where we spent literally millions of dollars feeding people. So I'm here to tell you we have some true leaders behind me. And as we stand here today, this is just a continuation of the leadership that is on display here in Baltimore County. This health department has done miraculous work throughout the pandemic. Yet at the same time, we can never forget opioids didn't go anywhere. Immunizations didn't go anywhere. The needs of the community were still there, and they did it all in spite of COVID and continue to do it. So here we are today providing more services to the citizens of Baltimore County, creating a one-stop shop. A one-stop shop which will make it more convenient for the residents, and it will provide additional services for the residents who could never seem to make one place or the other place and have to run the gauntlet. So I thank Dr. Bethea and Set the Captives Free for all you have done. And speaking of leadership, I'm here to tell you this is not something new for you. I've attended many, many, many events at your church, whether it been distributing food, whether it was giving backpacks to kids for school, or giving kids free haircuts to go back to school. So I've certainly been there and seen the work that you've done. And I'm joined by Delegate Pat Young, who's been right there doing a tremendous job at the state level as well as here in Catonsville. So I just want to say congratulations. Thank you so much for your leadership and everything you've been doing to keep us safe in Baltimore County. We welcome this facility. It'll continue to, in that vein, and create more services to the citizens, creating better health outcomes for all of the citizens in this area. So thank you very much for having me, and God bless all of you. Thank you. County Executive?
Yeah, I also want to just recognize Reverend Jerome. There you are, representing Senator Cardin as well today. And we'll turn things over to Delegate Young for a few brief remarks, and then we're happy to take any questions you all may have.
Mr. County Executive, thank you. Brief remarks. I just wanted to, come here and bring greetings from the legislature and from the Baltimore County delegation. I've been the chair for the last 3 years, and I can honestly say that the partnership between the county and the legislative branch of government has been something I did not experience in the past. It's just been amazing. Two things that were brought up before, and I just want to make sure anybody that's listening now recognizes the tremendous opportunity here and how hard it is to consolidate resources like this together in one place. They said it took 7 years, 7+ years to get this done, because it's not just about how long is it going to take, how much it's going to cost, but what is the impact on the community that's going to provide. And this center is going to provide a need that the county executive, the council, the Department of Health recognized was needed. And didn't matter how long it would take, didn't matter how much it would cost, but through partnerships with community partners and with legislative officials and elected officials, it got done because it was something that was needed. And statistically, unfortunately, a lot of folks talk about numbers and how we can affect things statistically, but every number is a family, every number is a person, every number is a constituent and a citizen of Baltimore County, and this is going to have a huge impact not only on this side of town, but for the entire region and for everyone that lives in Baltimore County. So thank you for the opportunity, and thank you for all you're doing. Thank you.
Floor's open. John.
Will the church play any role in the running of
The health department and the WIC services will be run by the Department of Health in Baltimore County solely.
will be no intermingling there as far as the actual operations?
Now, we will partner as it requires for different programming and things like that, but the running of this center will be done by the Department of Health.
I wanted to ask, beautiful new facility, 8,800 square feet. How does this play into the overall redevelopment of the mall? I know a task force was just created.
Yep.
Longer term conversations. We must have even more of a vested interest now in seeing this thrive and succeed going forward.
Sure. So this is a very real, tangible example of us planting our flag here to say that Baltimore County is invested in the success of this site and in this community. We know conversations have been ongoing, but rather than focus on what hasn't been, we're really moving towards what will be. And so we're thrilled to announce this partnership today with Set the Captives Free. Even as we work with the Randallstown NAACP and the task force, we invest internal resources to examine what's possible, to vision out with the community's partnership what they want to see this site be. But I think today is a microcosm of if we have a vision and we work together toward it, pretty much anything is possible. And so we're excited about the future of this site, and we're committed to its success.
I'd love to hear from Chairman Jones too, in terms of this footprint now here with this facility and conversations moving forward about how to improve and revitalize the mall here.
Yeah, well, I think what's important here today is we are very proud of this site. We're proud of the investment that continues to be made here at Woodlawn Security Mall, which is evident by what you're seeing here today. And I think in the end, we all would like an awful lot of things. We would certainly like to see all sorts of things, but it takes time and it takes one step at a time. And I think we are headed in that direction. So thank you.
Got a ribbon? Do you need help moving that? You got it?
Yep, Brad and I got it. I will do this and you grab the ribbon. For a wire that's going forward. And to the left. folks a moment to get ready. We'll go in for a little tour.
You want me to film it?